Hello friends, welcome to 8PG Concepts. I'm Dr. Shadab Japri, CMO at CHS Lucknow. Now, today we'll be going to deal another very important topic in our continuation to the cardiology episodes which we have been doing in the past. So now the topic today which we are going to deal is the ischemic heart disease, which is a very important topic, and the management part of the ischemic heart disease is repetitively asked in the every competitive examination, whether it is NEET PG or NICT. So we are going to deal with the management part later on, but before that, we will give a brief concept of what is the pathogenesis of the ischemic heart disease, and later on how this spectrum varies from the stable angina pectoris to unstable angina pectoris and NST, EMI, NST, segment elevated MI. So all these spectrums which are known as acute coronary syndromes. So we'll deal one by one later on, but before that we'll give a brief introduction. Now see in this photograph that chronology of the events as the uh, disease progresses with the time. Now you can see that the first endothelial and microvascular dysfunction are there. Then there's a decreased microvascular perfusion, altered metabolism and abnormal ST segment, then microinfarction, then diastolic dysfunction, then decreased segmental perfusion, regional wall motion abnormalities, and systolic dysfunction. So this is the chronology of events, and we'll further see in the next slide also. Now here you can see how the clinical manifestations develop gradually as the plaque progresses from its initial stages to the final stages when the angina pectoris develops. So you can see this. And now, before moving to our topic step by step, let's give a brief outline of the basics of the ischemic heart disease. Now, there is a stable angina pectoris, unstable angina, non-ST segment elevated MI, and the ST segment elevated MI. And the basic difference which has been asked in between the NST MI and ST MI is that the ST segment is elevated. The troponins are increased in both the cases, and the management part is different in STMI and non-STMI. In STMI, primarily we do percutaneous coronary intervention, and in NSTMI, primarily we have the drugs which are beta blockers, dual antiplatelet therapy, and anticoagulants like enoxaparin and other agents. Now coming to some practical aspects also which we often see in our OPDs, एंड व्हाट आर सबको किसी को भी चेस्ट पेन होता है, किसी को भी कुछ किसी भी तरह का चेस्ट पेन होता है, हम ईसीजी तुरंत करा लेते हैं, ईसीजी करा करके हम देखते हैं वो नॉर्मल है ईसीजी, तो फिर हमें क्या करना चाहिए? देन वी गो फॉर सम स्ट्रेस टेस्टिंग, और स्ट्रेस टेस्टिंग आर ऑफ वेरियस टाइप्स. वी कैन डू इन द treadmill test, which is exercise based test. Now sometimes these tests are not clear, then we go for a perfusion imaging test, perfusion imaging stress test. Then a stress echo is also done nowadays. This figure gives a better idea to the understanding of the previous figure. Now, as you see that I would like to emphasize one term which is known as silent myocardial ischemia, in which the exercise-induced ECG changes are not accompanied by angina pectoris, and the coronary angiographic studies of such persons may reveal coronary artery plaques and previously and unrecognized obstructions. So, coronary artery calcification may be seen on CT images of the heart. So, this CT coronary angiography is a new emerging modality of investigation in such patients, but it also gives false positive results. So the coronary angiography is the best investigation in such cases. Now I would like to emphasize one more term which is known as ischemic cardiomyopathy. What is ischemic cardiomyopathy? Patients with ischemic heart disease can also present with cardiomegaly and heart failure, secondary to ischemic damage of the left ventricle myocardium that may have caused no symptoms before development of heart failure. This condition is referred to as ischemic cardiomyopathy.